So the topic name is the CDM, means the clinical data management. So first of all, starting from the drug discovery methods. So there are total 5 drug discovery methods. In that, the first one, that is the random screening. Second one, it's a molecular manipulation. Third one, it's a molecular designing. Then fourth, it's a drug metabolites. And fifth, it's a serendipity. So first method, that is the random screening. So what is the random screening? First of all, see its definition. So all available chemical substances are submitted to the variety of a biological test. It means the random screening. And its definition, that is the random testing or a screening means selection of a molecule or a thing or a people for the test arbitrary. Random screening, which included in the traditional drug delivery, that involves the origin of the drug, discovery that evolve in natural sources, accidental events that evolve in natural sources and accidental events. Then it is not on target as well as the synthesized based. It includes the random screening of synthetic compounds, natural products by bioassay method. It's involve the two approaches, like the testing or screening of a compound or a selection of a compound like the alkaloids, flavonoids, etc. And second one, that is the fasting or screening of randomly selected plants. This method is not used because the first one, it is the time consuming method. Second one, that is the require more manpower. And third one, it's near the more compound. So this method is not beneficial, and this method is not used randomly. For example, the antibacterial drug, that is the tetracycline. Then second topic, that is molecular manipulation. So what is the molecular manipulation? It is a method which included in the molecular modification, in that there is a chemical modification of a molecule. Due to this, they reduce the side effects, superior or increases the pharmacological properties. For these manipulations, we are used the drug from a plant and animal sources as a starting material in the creation of a slightly different molecules or different changes. Drug or a molecule are synthesized or a test for the biological activities. This is logical approaches, in that the new synthesized compound has certain changes like the absorption, greater potency, more selective actions, etc. For example, it's a morphine and the sulfonylide drugs. So the third topic, that is the molecular designing. So what is the molecular designing? This is based upon the molecular activity and the chemical structure. It is the inventive process. Drug design means the design of a molecule that the complementary in a shape and charge to the molecular target with which they interact and bind. Due to the structure design of the new substances, they fulfill the specific biological task. In that, the technique initially identifies the target molecule, then they design the molecule which can interact with the target, which might be helpful in the treatment of a disease. Computer can visualize the receptor and can design the matching the drug molecule, in which for example which drugs are included, that is the allopurinol, an analog of the xanthine. Fourth topic, that is the drug metabolites. So what is the drug metabolites? Prodrug agents, that is the administered as the precautionary of a drug, convert into the active therapeutic agents. It is complex process involving the transport and metabolites enzyme with physiological consequences and pharmacological and toxicological effects. Many drugs can be converted to one or more active ingredients or metabolites in the body. These metabolites, which are active in nature, gives the new therapeutic activities. For example, the drug, that is paracetamol, and active metabolites of the phenacetin. The fifth topic, that is the serendipity. So what is the serendipity? It's a discover by chance. Its proper definition, that is, it is the accidental discovery, luckily or suddenly, by the pharmacist, chemist, physician, or other investigations, is called as a serendipity. It plays the important role in discovery or a psychotropic drugs that leads to the modern pharmacological treatment in the psychiatry. For example, the drug that is aniline purple, penicillin, lysergic acid, diethylamide, meprobamates, chlorpromazine, etc. Antibiotics, in which example that is the penicillin discovered by the Alexander Fleming in 1928. That is the proper example of the serendipity. And that topic is covered. Thank you.